widespread the violations of HIV and AIDS patients, about their human rights, how severe the violations of these rights were. And the main content of the survey, basically the survey was done using the SF36, which is a short survey consisting of 36 questions, which is set according to the Likert scale. And this survey basically asked AIDS patients about their current health condition, their quality of life, and other factors as mentioned here. And as a result of the survey, the survey result was that the human rights status of HIV and AIDS patients was significantly low because HIV/AIDS patients' human rights were being severely violated in Korea. So this organization recommended to the government several changes and several proposals for changing the AIDS prevention law so that the human rights of AIDS patients would not be violated as much. And yeah, these proposals were sent to Congress for review. And unfortunately, many of the changes that the NHRC proposed to the Congress were not adopted. So the AIDS prevention law was not changed to a great extent. And then now in 2010, which is 5 years later from the original survey, it's meaningful to study whether, to what extent the human rights status of HIV and AIDS patients has improved, and whether these suggestions by the NHRC have been reflected in the current AIDS prevention law, which is what I was just talking about. So what I did was, from June 7, 2010 to July 9, 2010, I conducted a survey of HIV and AIDS patients in Korea, using the same survey that was used in 2005 so that it would be consistent. I surveyed AIDS patients again to see how much the human rights status of AIDS patients have changed. And then so I used the same conditions that were used in the 2005 survey. And yeah, the results are on the next slide. So the first category is human rights violations of HIV/AIDS patients upon their initial recognition of the disease. So what this means is basically a part of the original survey asked how the human rights of HIV and AIDS patients were violated when they first found out about their disease. So 23.8% of patients first recognized their disease through free HIV and AIDS testing and general medical testing, and then basically, so from 2005, basic testing before surgery, basic testing for just basic general medical testing before surgery increased from 21.7% in 2005 to 4.8% in 2010, and then so the majority of patients received positive results for HIV/AIDS testing without being fully prepared to accept their infection status. So what this means is that basically HIV and AIDS, when a patient has it, it is the doctor's responsibility to kind of explain what their disease means and explain the possible future consequences of their disease. But unfortunately in Korea, many doctors are just telling the patients that they have AIDS, but they're not telling them about, they're not telling them that it's okay that they have the disease. They're just merely telling them their status. And so AIDS patients aren't fully prepared to accept it, which is the same as in 2005. And of the respondents, 52.7% replied that their HIV/AIDS infection status led to divorce or separation. And then compared to 51% in 2005, this is the percentage is almost equal. And then so this shows that if a person has HIV or AIDS, then their status has a great effect on marital life. And then the percentage of respondents who are not thinking about being involved in any more relationships increased from 53% in 2005 to 70% in 2010. And then when HIV/AIDS patients were declared to be positive for their disease, 19% were office workers, and 19% were service workers and specialists. And the percentage of respondents who quit their job as a result of their status increased from 51.2% in 2005 to 72.7% in 2010. And the reason why so many people are quitting their job is that, as I mentioned before, the Confucian nature of South Korea has a great role on how much discrimination AIDS patients face in Korea. And then so if the workplace finds out that a worker has HIV and AIDS, then basically, even though it's against the law, the workplace will highly pressure these patients to quit their job, and as you can see, the trend is that more people are quitting their jobs when they have the disease. And currently, the percentage of unemployed HIV and AIDS patients is 81.8%, which nearly doubled from 44% in 2005. And yeah, so this is another part of the survey I conducted, but because of time limits, I'll just move on. Next. Yeah. Could you move on? So yeah, difficulties in everyday life. 81.8% responded that financial problems were the most difficult part of their life. And then 45.5% said the worsening of their disease, so the further progression of their disease. And then 27.2% said fear of exposure of their HIV/AIDS infection status. And then in particular, the percentage of those who said that financial problems were the most difficult tripled from 26.6% to 81.8%. And the reason for this is that because so many HIV/AIDS patients are being pressured by society and by the workplace to quit their jobs, they have no means of financially sustaining themselves. And I'll mention it later, but the government of Korea offers a stipend of about $350 per month to HIV/AIDS patients, but then $350 is not enough to live on for one person for a month. And then this is why so many people are finding it hard to sustain themselves financially. And then, so as you can see from these previous slides, the basic fundamental thing we should realize is that the human rights of HIV and AIDS patients have not significantly improved from 2005. Even though 5 years have passed, the human rights are still being violated to a great extent. And then so this is why the government should establish a policy to not only financially support HIV/AIDS patients, but also change the law, change the AIDS prevention law, so that HIV and AIDS patients' human rights will not be violated. And so basically, this slide just shows that these are some of the most important government policies that HIV/AIDS patients think they should have. So 54.5% responded that there should be government policies regarding home care, and 45.5% responded with health consulting and etc. And then the greatest problems with government policies, basically 54.5% of respondents said that the government does not have the will to protect and support HIV and AIDS patients, and 31.8% said that the government really treated HIV and AIDS patients as a group of people that should be controlled and managed. And then this slide shows the quality of life of HIV and AIDS patients in comparison to diabetics in 2005. So for my survey, I used the SF36 tool, which evaluates physical and mental condition through the Likert scale. And basically this total shows how much, this shows a comparison of the human rights condition of diabetics compared to HIV and AIDS patients. So this number of 61 is higher than that of 48 and 51, which shows that the human rights condition of HIV and AIDS patients is still lower than diabetics. Even though there was an increase from 48 to 51, it's still lower than the quality of life that diabetics had in 2005.